This is a difficult time for public health across the world, and in some ways, I feel quite sad in the sense that I'm one of those people who continue to ask questions. What many people would prefer is that certainly people in the scientific and medical community just get themselves focused, stick with the narrative, stop talking about any issues with regards to the pandemic, and move on. And that is certainly easy to do. The difficulty is that I am genuinely not sure if that is the right thing to do. The recent situation in the United States with regards to the shooting at the CDC brings this especially into focus. Now, the USA is extremely unique in terms of gun control laws, and so anger can be expressed in very dramatic ways. But we have to remember that a life was lost trying to protect other individuals at the CDC. And we don't want a situation where people feel their life is in danger. My concern is that silence seems to be fueling the flames. So when I thought about this piece of research and I decided to look at what was going on, I then took to looking at the X platform, because it has a relatively non-censorship approach, so people can say what they want. And I used it with the assistance of AI to try and work out what is the general consensus with regards to the public. And that in itself was very interesting. And here is what it found. When we look at sentiment, sympathy, and grief for the officer and family, that's about 40%. Tributes and memorials and support for law enforcement. When we look at concern over misinformation and the association with violence, that was about 35%. And they blamed the anti vax rhetoric, and they're concerned about public health workers. In terms of anti vaccine and conspiracy support, 15% of people who justify the shooter's grievances and are predicting more incidents. And neutral is about 10%. This reality of 15% should not be discounted. And this is the point that I am making. I am privileged in the sense that as I interact with the public through social media, I get and see lots of comments, and I see a clear idea as to what people are thinking. And combined with the fact that trust in doctors has fallen 30% in 4 years, the kind of perceptions about what happened in the pandemic with vaccines, the impact of vaccine mandates on unvaccinated people, the association and concern from people who have had vaccine injuries is probably one of the most serious. And I'll come to this specific case in just a moment. But you have to realize that one of the straight knock on effects as to what was happening here is the fact that a number of people were calling for the Robert F. Kennedy to be removed from his position. And this is a group, Fired But Fighting, and they are a coalition of HHS employees and allies who have recently been let go from their job, and they were abruptly terminated. And they are calling for the immediate resignation of Robert F. Kennedy, one of the architects of Project 25. This is Director Russell Vought. The armed attack on the CDC today, which claimed the heroic life of a police officer and left the CDC workers devastated and traumatized, reflects the realization of these directives. So there is a lot going on and a lot to unpick. But the first step, and I am unsure how easy this is going to be to do, is that there was a cohort, or there is a cohort of the population who acknowledged the directives that were given to them early in the pandemic about protecting themselves, not so much themselves as much as Gran, and stopping the pandemic. They got vaccinated, 1 dose, 2 dose, 3 doses, 4 doses, and some people got injured. And what they were faced with is the worst of both worlds, because they were ignored because it damaged the vaccine narrative. If they said they had a vaccine injury, the first question is prove it. Show us that this is a vaccine injury. Can you imagine how that feels for someone who had no prior illnesses? Then, on the other side, they were faced with people who were against the vaccine mandate, saying it served you right. You went and took it. This is the outcome. Now, when you think about that and you think about the implication psychologically for this cohort in this kind of situation, it makes you realize that in an environment where people have access to tools that can cause harm, it is concerning that this kind of situation could happen again. And that's the big concern. Is the answer to just stop talking about vaccines and to move on from the pandemic? In my view, I don't think so. And part of the reason is because the virus is still circulating in highly vaccinated regions. Based on my extrapolation of the science, there is nowhere to hide. This has got to be addressed. The question is when. Do you wait, as they have tried in the past? This is maybe 3 years down the line. The hope, I think, is that it will just go away. This will just pass on. The public will move on. The problem is the virus is still circulating. People are still getting sicker and sicker, and they want answers. And currently, we seem to have a silence. So here is the story, so to speak, and this is from AP News. The CDC shooter believed the COVID vaccine made him suicidal, his father tells police. So the first thing you have here is that there isn't still any acknowledgement that the COVID vaccine may have caused this individual any harm. That in itself is going to be part of the problem. And can you imagine if he didn't have issues beforehand and then subsequently had mental health issues and was associating it with the vaccine, and then to be told it's not connected? In this situation, especially with mental health issues, that can cause someone to break. And when we look in more detail at the story, sadly, 2 lives were lost in the sense that he opened fire at the headquarters, shooting dozens of rounds. He killed a police officer, and subsequently, he moved on to kill himself. He had a number of guns, and it's clear that this was a very sad situation, something that we don't want to see any more of. But what can be done? So, for those people who understand about artificial intelligence and they know about narratives and so on, I was having an interaction with Super Grok about what had happened. And of course, within the narrative, it says that there's a lot of anti vaccine misinformation out there, and this contributed to this person then doing these acts that caused harm. So, what I did is I then positioned a question. I said, imagine for a second that there was a problem and that harm had been done at a population level and that many people were sick and this was not going to go away. What could public health, in this case, the CDC, we're talking about, but this is a question that is relevant to every country. What could and should they do? Here are the 5 points that I want to highlight that I think is extremely relevant now. The first point is immediate acknowledgement and transparent communication, because it minimizes withheld. And so public statements, open honesty reduces conspiracy theories. One of the difficulties that we've had is that there have been many changes to what has happened with regards to the vaccine rollout, and there isn't clear explanation as to exactly why. What did you get wrong? Why did you get it wrong? what needs to be done now. And that kind of open communication hasn't been happening anywhere really in the world. All public health organizations seem to be about protecting a narrative. And that is, in my view, very, very dangerous because it leads to further problems. The second thing is that it suggests empathy and support for affected individuals because it will minimize the outrage. Outrage escalates if people feel ignored. Showing care humanizes the agency and shifts focus to solutions. One of the big issues we're facing now is that most people say these issues are rare. Maybe they'll come up with one in a million, or I don't know what. And what that does is that it almost gaslights the person who believes that they are suffering. And that's not right. That is not empathy. You cannot have a situation where mandates were used, people were very strongly encouraged, and if they got side effects or harms, there is no empathy. That leads to problems, as we're seeing. The third point was to do with independent investigation and accountability. And again, internal reviews can be biased. And in some countries, we're seeing something closer where they are having COVID um, external independent reviews. Sadly, many of the commissions have specific ideas and they still are not quite addressing many of the serious issues. One of the points that I make, and anyone who tells me about the science and the importance of what it shows, I remind people that without autopsy data, what you're talking about is still largely not likely to hold water. We're in an unusual environment. We need really good data. And in my view, if you're not doing autopsies, you're not genuinely looking to try and understand if there could be harm. So that's the other part. The fourth point was to do with proactive risk mitigation and future prevention. And again, it demonstrates learning and improvement and reassures the public that you won't do the same mistake again. And this is really, really important in an environment where people still don't trust that the actions that were taken in the pandemic wouldn't be repeated again if the same situation occurred. And I think that's one of the most serious concerns from many members of the public. There is no acknowledgement of errors. There is no acknowledgement that, okay, we went too far. Everybody is covering. And so, therefore, it means that the public doesn't have trust built because this has not been properly addressed. So, the other thing is that when you're looking at harm, your question should be why? Why did this person have this problem? And within the duty of candor, you're supposed to then actively seek to understand the mechanism of harm. In order to do that, you really have to be looking. And at the moment, can anyone tell you who is most at risk for adverse events and why? What is the mechanism? So when you are genuinely trying to find answers, that's the kind of question that you would ask. The final point is monitoring and adaptive responses. Ongoing engagement shows that the issue hasn't been swept under the rug. Track the public sentiment, work with messengers, evaluate the response's effectiveness. These are the kind of things that need to be done in order to try and address some of the underlying anger that exists across the population. If you've joined late, this is the reality with the numbers when it was analyzed about the situation of the shooting at the CDC with a life lost. You remember, it's not just randomly shooting in the air, it's not somebody just shouting. A life was lost, two lives, the shooter as well as a police officer. And even in that situation, the sentiment still highlights that 15% of the users can understand why this occurred. If this doesn't make public health sit up and think to themselves, oh my goodness, 15% of people are thinking that this kind of situation is understandable, is an absolute red flag. We're not talking about a fringe 1% or 0.5% of people who have strange views. This means that 15% potentially of the population broadly are that angry with the outcomes that they could empathize and go, I would understand why someone did that. That is huge. And so I hope that all of the public health agencies take this situation, don't ignore it, don't just argue that it shouldn't have been done. I don't think anybody would disagree with that, but address it. Look at what is going on. Understand the mechanism and understand the anger. Because if that has not been addressed, and if people continue to get sick and mortality continues to rise, this could only become worse in the longer run. There is still a lot of work to be done, and we hope that the right people are genuinely trying to make a difference. Thank you.